This is the New Chemist's podcast breaking news announcement. Good evening, ladies and gentlemen. We interrupt your distractions to remind you of the ambitions that fuel your aspirations. We interrupt your diversions to furnish you with pivotal notions and ideas to realize your objectives. We interrupt your preoccupations to underscore the importance of maintaining good health, extending a hand to others in their pursuit of well-being. And now, we are delighted to begin this episode of the New Chemist's podcast, a beacon of knowledge and insight for educational purposes. Stay tuned for a world of discovery. This is the New Chemist's podcast, and we are here to keep you informed and inspired.
Welcome to the New Chemist podcast, one of the best chemistry podcasts globally. We are glad you are listening. We encourage you to subscribe and continue to listen.
Welcome to the New Chemist podcast. We are glad you are listening. We are one of the best chemistry podcasts globally. We encourage you to subscribe and continue to listen.
Welcome to the New Chemist podcast.
We are so glad you are listening.
Feel free to subscribe on Spotify and tell your friends and colleagues about the podcast.
Our Deepest Fear by Marianne Williamson. Our deepest fear is not that we are inadequate. Our deepest fear is that we are powerful beyond measure. It is our light, not our darkness, that most frightens us. We ask ourselves, who am I to be brilliant, gorgeous, talented, fabulous? Actually, who are you not to be? You are a child of God. Your playing small does not serve the world. There's nothing enlightening about shrinking so that other people won't feel insecure around you. We are all meant to shine as children do. We were born to make manifest the glory of God that is within us. It's not just in some of us. It's in everyone. And as we let our own light shine, we unconsciously give other people permission to do the same. As we're liberated from our own fear, our presence automatically liberates others. Our Deepest Fear by Marianne Williamson. You are very important, especially to us here at the New Chemist podcasting group. You listening in is significant.
Vous êtes très important, surtout pour nous ici au New Chemist Podcasting Group. Votre écoute est significative.
Usted es muy importante, especialmente para nosotros aquí en The New Chemist Podcasting Group. Usted escuchando, es significativo.
Você é muito importante. Especialmente para nós do The New Chemist Podcasting Group. Você ouvindo, é significativo.
Είστε πολύ σημαντικοί, ειδικά για εμάς εδώ στο The New Chemist Podcasting Group.
Το να ακούς είναι σημαντικό.
Sie sind sehr wichtig, besonders für uns hier bei The New Chemist Podcasting Group. Es ist wichtig, dass du zuhörst.
Je bent erg belangrijk, vooral voor ons hier bij The New Chemist Podcasting Group. Dat je meeluistert, is veelbetekenend.
You are very important, especially to us here at the New Chemist Podcasting Group. You listening in is significant. Welcome to the New Chemist Podcast.
Bienvenidos al podcast del nuevo químico.
Καλώς ήρθατε στο podcast του New Chemist. Welkom bij de podcast van The New Chemist.
Bienvenue sur le podcast du nouveau chimiste.
Bem-vindo ao podcast do novo químico.
Welcome to the New Chemist Podcast. Work hard. Be value-driven. You can do it. You can grow and learn it. You can be the difference you and your community needs. Don't give up. We are here, rooting and cheering for you. Don't give up.
Travaillez dur. Soyez axés sur la valeur. Tu peux le faire. Vous pouvez grandir et l'apprendre. Vous pouvez être la différence dont vous et votre communauté avez besoin. N'abandonnez pas. Nous sommes ici pour vous encourager et vous encourager. N'abandonnez pas.
Trabalhar duro. Seja orientado por valores. Você consegue. Você pode crescer e aprender. Você pode ser a diferença que você e sua comunidade precisam. Não desista. Estamos aqui torcendo e torcendo por você. Não desista.
Δούλεψε σκληρά. Να οδηγείτε στην αξία. Μπορείς να το κάνεις. Μπορείτε να μεγαλώσετε και να το μάθετε. Μπορείτε να είστε η διαφορά που χρειάζεστε εσείς και η κοινότητά σας. Μην τα παρατάς. Είμαστε εδώ για να σας ζητοκραυγάσουμε. Μην τα παρατάς.
Trabaja duro. Sea impulsado por el valor. Puedes hacerlo. Puedes crecer y aprenderlo. Usted puede ser la diferencia que usted y su comunidad necesitan. No te rindas, estamos aquí animándote y animándote. No te rindas.
Werk hard. Wees waardegedreven. Je kunt het. Je kunt groeien en leren. U kunt het verschil zijn dat u en uw gemeenschap nodig hebben. Geef niet op. We zijn hier om voor je te roten en te juichen. Geef niet op.
Work hard. Be value driven. You can do it. You can grow and learn it. You can be the difference you and your community needs. Don't give up. We are here rooting and cheering for you. Don't give up. Thanks for listening. We're glad you were able to tune into this podcast. Once again, this is The New Chemist, where we discuss chemistry, which simply put is the science of change, as well as the other sciences, careers, community, research, and COVID-19. Thanks again for listening. Note, the views on this podcast represent those of my guest and I.
In the world of pharmacy, we lay the claim. Knowledge and compassion is the golden flame. Science and practice, side by side they groove. In a student's journey, we find the move.
Purpose of these episodes not at all for advice or medical suggestions. These are aimed to provide support to peer pharmacists in training in educational and intellectually stimulating ways. Again, these are not at all for medical advice or medical suggestions. Please see your local board and state certified health professional. The views of this podcast represent those of my guest, S, and I tell me not, in mournful numbers, of the drugs that life encumbers, fluconazole, with names so bright, candidiasis, it helps to fight. Fluocinanide, for skin so fair, plaque psoriasis, it helps repair, with atopic dermatitis, it's in the fray, to bring relief and light the way. Floxetine, Prozac's name we know, for depression and OCD, it helps us grow, panic disorder and more it tends, to mend our hearts and make amends. Fluticasone, both nasal and inhaled, allergic rhinitis and asthma's tale, it fights the woes that we endure, inhaling deeply, our health is sure. Folic acid, in the name of Fa8, megablastic anemia, it does abate, fosinapril, for the heart's desire, to heal the ills that might transpire. Furosemide, Lasix's sound so clear, edema and overload, it's here, to help the heart, and kidneys too, in their struggles to push through. Gabapentin, with Neurontin's grace, eases seizures, and neuralgia's chase, Gatafloxacin ophthalmic, for eyes so bright, in bacterial conjunctivitis, it's the light. Gemfibrozil, Lopid's name proclaimed, for hyperlipidemia, it's famed, Glecaprevir / P-Brentasvirer, Mayvirit's song, fights hepatitis C all along. Glympyride and glipizide in the air, against diabetes, they both declare, Guanfacine, for focus and hypertension's grip, in the world of medication, they equipment Haemophilus influenza, serotype B vaccine, ACT HIV, Hyberix, it's not routine, to prevent the invasive HIV's decree, in children's health, it's the key. Hepatitis A and B vaccines strong, Havrix, Recomivax HB, their song, preventing infections that can harm, in their protection, we find charm. Human papillomavirus vaccine, Gardasil 9's pride, preventing infections far and wide, cervical cancer, warts, and more, in its shield, we find the core. So, in the world of medicine's art, these drugs play a vital part, let us use them with care and grace, in the healing journey we embrace. The ANS, the body's silent guide so true, innervates muscles, glands, with fibers too. Though bones are not within its vast domain, sensory nerves supply its vital rein. Endocrine and autonomic systems pair, maintaining balance, care, and tender care. The brainstem and sacral parts give rise to sympathetic nerves and parasympathetic ties. Motor impulses transmission is distinct, two neurons chain the path, in fact, succinct. The first, preganglionic, in ganglia's seat, the second, postganglionic, brings the heat. Catecholamines in play, they fuel the drive, From Ne to AP, they help us thrive. In vesicles, they're stored until they're needed, A. Calcium influx, secrets then conceded. Adrenergic receptors, alpha and beta split, alpha 1 leads to calcium's critical fit. Alpha 2 inhibits, causing a decrease in feedback loops, the system finds its peace. Beta 1 mediates the heart's own beat, adenylate cyclase, it can't defeat. Beta 2, favored by epinephrine's call, relaxes vessels, wide and small. Termination occurs, with uptake of care, MAO, and COMT play a role, a pair. Cholinergic neurons, in them we confide, in muscles, nerves, and vessels they abide. Choline and acetyl, they intertwine, to form ACH, our messenger, so fine. Stored in vesicles, ready for the task, ACH's release brings answers that we ask. Cholinergic receptors, M and N so dear, they modulate our actions without fear. Phospholipase, potassium, they sway, in the grand scheme, they lead the way. In neuromuscular junctions, they control the cation channels, opening the toll. In CNS and ganglia, their reach extends, these cholinergic systems, our body tends one. Fluconazole, brand name, diflucan. Indicated, 1. Candidal vulvovaginitis uncomplicated 2. Candidal vulvovaginitis complicated 3. Candidiasis, systemic 4. Cryptococcal meningitis 5. Oropharyngeal candidiasis 2. Fluocinolone topical, brand name, Lidex, venose indication, 1. Skin disorders, corticosteroid responsive 2. Plaque psoriasis 3. Atopic dermatitis 3. Floxetine, brand name, Prozac, Seraphim indication, 1. Bipolar major depression 2. Major depressive disorder 3. OCD 4. Panic disorder 5. Premenstrual dysphoric disorder 5. Bulimia nervosa 4. Fluticasone nasal, brand name, Flonase, Hans indication, 1. Allergic rhinitis 2. Non-allergic rhinitis 3. Nasal polyps 5. Fluticasone oral inhaler, brand name, Armin Air, DG Holler, Armin Air, Respiclick, Arnuity, Ellipta, Flovent, Discos indication, asthma 6. Fluticasone/salmeterol, brand name, Advair Discos, Advair HFA, Air Duo, Respiclick, Wixela, Inub indication, asthma, COPD 7. Folic acid, brand name, Fa8 indication, megablastic and macrocytic anemia due folic acid deficiency 1/38. Fosinapril, brand name, Monopril indication, 1. Heart failure 2. Hypertension 9. Furosemide, brand name, Lasix indication, edema of volume overload related to heart failure, and renal failure. 10. Gabapentin, brand name, Neurontin, Grelise indication, 1. Partial seizure, adjunct 2. Post-herpetic neuralgia 11. Gatafloxacin ophthalmic, brand name, Zymaxid, indication, bacterial conjunctivitis 12. Gemfibrozil, brand name, Lopid 1. Coronary arteriosclerosis prophylaxis familial combined hyperlipidemia 2. Familial type B hyperlipoproteinemia Fredrickson 3. Type 4 hyperlipoproteinemia 13. Glecaprevir/P. Brentasvir, brand name, Mabfret, indication, 1. Chronic hepatitis C infection with genotype 1 to 614. Glympiride, brand name, Amaryl 15. Glipizide, brand name, Glucotrol indication, diabetes mellitus 16. Guanfacine, brand name, Intuniv indication, attention deficit hyperactivity disorder, extended release only, hypertension, immediate release only, 17. Haemophilus influenza, serotype B vaccine, brand name, Hyberix, Pedvax HIB prevention of invasive H.influenza type B, HIB, infection, children 18. Hepatitis A vaccine, brand name, Havrix, Vagda indication, Hepatitis A Prophylaxis Act HIB, 2/319. Hepatitis B vaccine, brand name, Endrix B, Recomivax HB, prevention of hepatitis B infection 20. Human papillomavirus vaccine, HPV brand name, Gardasil 9 prevention of human papillomavirus infection, cancer and precancerous lesions of the cervix, vulva, vagina, and anus and genital warts 3/3 title, Neurotransmitters, the building blocks of mood. Ladies and gentlemen, today we delve into the intricate world of neurotransmitters, the chemical messengers that play a crucial role in regulating our moods and emotions. Just like the growth of good timber, these neurotransmitters face challenges and storms, but they are essential for maintaining our mental well-being. Flashback questions: when you think of mood disorders, what are neurotransmitters? Which neurotransmitters come to mind? Neurotransmitters are the key players in our emotional and mental states. When we think of mood disorders, several neurotransmitters come to mind, including serotonin, norepinephrine, and dopamine. Serotonin, 5-HT, serotonin, or 5-HT, is often associated with feelings of well-being and happiness. This neurotransmitter can be found throughout the body, with receptors in the central nervous system, CNS, gastrointestinal tract, and blood platelets. Depending on its location, serotonin can lead to different responses. In the CNS, it regulates mood and plays a crucial role in appetite, sleep, and blood clotting. Norepinephrine, on the other hand, is often referred to as the fight or flight neurotransmitter. It stimulates the sympathomimetic system and has receptors in various parts of the body, including the CNS, blood vessels, bladder, and eyes. Norepinephrine also plays a role in anxiety, opioid withdrawal, and hypertension. The role of dopamine, the neurotransmitter of reward and pleasure, has a range of actions depending on its location in the brain or periphery. It plays a significant role in motor control, motivation, arousal, pleasure, reward, learning, and mood regulation. Additionally, it is essential in the pharmacology of antidepressants. Antidepressant pharmacology: antidepressants primarily work by increasing the release or blocking the reuptake of three key neurotransmitters, serotonin, norepinephrine, and dopamine. They have a profound impact on mood regulation, appetite, cognitive alertness, behavior, sleep, attention, pleasure, and energy. DSM-5 criteria for major depressive disorder: to diagnose major depressive disorder, 5 or more specific symptoms must be present during a 2-week period, with at least one being either a depressed mood or loss of interest or pleasure. These symptoms include changes in appetite or weight, insomnia or hypersomnia, depressed mood or irritability, decreased interest or pleasure, and more. Contributory factors: several factors can contribute to mood disorders, including medications like beta blockers, corticosteroids, interferons, clonidine, and oral contraceptives. Conditions like multiple sclerosis, Parkinson's disease, thyroid disorders, and hypothyroidism can also play a role. Antidepressant classes: antidepressants are classified into several categories, such as selective serotonin reuptake inhibitors, SSRIs, selective serotonin and norepinephrine reuptake inhibitors, SNRIs, tricyclic antidepressants, TCAS, monoamine oxidase inhibitors, MAOIs, and miscellaneous antidepressants like bupropion and mirtazapine. Selective serotonin reuptake inhibitors, SSRIs. SSRIs work by inhibiting the reuptake of serotonin in the synaptic cleft, thus increasing serotonin levels. They have a positive impact on mood, anxiety, sleep, and interest. However, they should not be combined with MAOIs, and discontinuation can lead to withdrawal symptoms. SNRIs and tricyclic antidepressants: SNRIs, like venlafaxine and duloxetine, inhibit the reuptake of both serotonin and norepinephrine, providing a broader effect. They share similar side effects with SSRIs, including nausea, diaphoresis, anxiety, and more. Tricyclic antidepressants also affect serotonin and norepinephrine but have additional side effects due to their action on other receptors. Monoamine oxidase inhibitors, MAOIs work by inhibiting the enzyme responsible for metabolizing catecholamines, thereby increasing their duration in the synaptic cleft. MAOIs have dietary restrictions and interact with various medications, including SSRIs. Miscellaneous antidepressants, bupropion and mirtazapine. Bupropion is a stimulating antidepressant that lacks some of the side effects seen with other antidepressants, making it a valuable option for some patients. Mirtazapine, on the other hand, is useful for palliative care and oncology patients, particularly in managing sleep and appetite stimulation. Just like good timber that grows stronger through challenges and storms, these neurotransmitters and antidepressant medications are crucial for helping individuals cope with mood disorders. Understanding the role of neurotransmitters in regulating our emotions is essential in the field of mental health. In closing, remember the common law of life: the stronger wind, the stronger trees, by sun and cold, by rain and snow, in trees and men, good timbers grow. In the realm of mood regulation, neurotransmitters are the building blocks of our emotional well-being, and the knowledge of their roles is essential for effective mental health treatment. In the realm of neurosciences art, we delve into the mind, a world apart, to understand the drugs that mend, the pharmacology of antidepressants, my friend. Serotonin, a beacon of light, in mood and appetite, it takes its flight, found in the brain and blood alike, it regulates our joy, and helps us sleep at night. Norepinephrine, the fight or flight's embrace, in the body, it finds its rightful place. Anxiety, opioid woes, and hypertension too, its reach extends to more than just a few. Dopamine, the pleasure song it sings, in reward, motivation, and learned things, it controls our mood, behavior, and more. In the dance of neurotransmitters, it's at the core. Antidepressants, the saviors we seek, they target these messengers, strong and unique, with SSRIs, serotonin's where they mend, enhancing mood, anxiety they tend to bend. SNRIs, both serotonin and norepinephrine they share, in mood, attention, and energy, they truly care, but side effects lurk, as they sometimes do, nausea, sweating, and more, the patient's view. TCAS block reuptake of serotonin and norepinephrine's light, but side effects, weight gain, and sedation take flight, dry mouth and vivid dreams, they bring along, in the journey to alleviate sadness, they belong. MAOIs, a different path they pave, inhibiting enzymes, serotonin they save, but interactions with food, a caution must be told, with aged cheese and more, their use is controlled. Bupropion, an outlier in the game, stimulating, motivating, with a different name, no 5-HT side effects, it's a unique choice, for those who seek relief without losing their voice. Mirtazapine, known for its sleep and appetite's delight, in palliative care, it shines so bright, good timber, like good drugs, doesn't grow with ease, the stronger the challenge, the stronger it will please. In the world of antidepressants, a forest of care, the pharmacology's art, we must be aware, for the mind's a delicate, complex domain, where the right treatment can soothe the deepest pain. In the world of pills and potent brews, where science seeks to chase the blues, a pharmacist, with wisdom deep, shall now the tale of drugs and sleep. The pharmacology of antidepressants, let us unfold, in neurotransmitters' tales, our stories told. Serotonin, the harbinger of joy and mirth, regulates mood and appetite since birth. In the central nervous system, it takes its stand, affecting sleep, and even blood clots demand. Norepinephrine, the fight or flight's grand prize, throughout the body, it awakens our eyes. From CNS to vessels, and even the bladder's grace, it plays a role in anxiety's daunting face. Dopamine, the neurotransmitter of delight, in various areas, it keeps our spirits bright. For motor control, arousal, and pleasure's chase, in learning and mood, it finds its rightful place. Antidepressants, in their pharmacologic way, work on these messengers to brighten the day. Selective serotonin reuptake inhibitors, SSRIs, they're named, blocking reuptake, serotonin's path reclaimed. With fluoxetine, sertraline, and others you see, they ease depression, anxiety, and set the mind free. But SSRIs may bring some side effects near, like insomnia, nausea, or a bothersome fear. SNRIs, the dual action, serotonin and norepinephrine's friend, lift mood and energy to a higher trend. Venlafaxine, duloxetine, and their kind, with a 14-day break from MAOIs, keep in mind. Nausea, sweating, and teeth grinding they might do, but withdrawal symptoms can haunt you too. Tricyclic antidepressants, or TCAS they're known, like serotonin and norepinephrine, they've grown. But they block ACH and histamine receptors, you see, resulting in weight gain and dry mouth with glee. Monoamine oxidase inhibitors, the MAOIs stand tall, metabolizing catecholamines, they enthrall. The synapse welcomes their prolonged stay, improving mood in their unique way. Bupropion, a stimulating one in the mix, norepinephrine, and dopamine it tricks. Lacking 5-HT side effects, it claims its fame, but insomnia and tremors may play in its game. Mirtazapine, for sleep and appetite's desire, for MDD and palliative care, it's quite the squire. Inhibiting 5-HT and alpha-2 it shall, with high receptors, it answers the call. So, in the world of pills and their design, the pharmacology of antidepressants, so fine. With neurotransmitters and their intricate dance, they offer solace, hope, and a second chance. Just like the good timber, strong and true, withstood the storms, and through troubles grew, in the forest of our minds, they stand with grace, offering relief, in life's intricate embrace. Title: Neurotransmitters, the building blocks of mood. Ladies and gentlemen, today we delve into the intricate world of neurotransmitters, the chemical messengers that play a crucial role in regulating our moods and emotions. Just like the growth of good timber, these neurotransmitters face challenges and storms, but they are essential for maintaining our mental well-being. Flashback questions: when you think of mood disorders, what are neurotransmitters? Which neurotransmitters come to mind? Neurotransmitters are the key players in our emotional and mental states. When we think of mood disorders, several neurotransmitters come to mind, including serotonin, norepinephrine, and dopamine. Serotonin, 5-HT, serotonin, or 5-HT, is often associated with feelings of well-being and happiness. This neurotransmitter can be found throughout the body, with receptors in the central nervous system, CNS, gastrointestinal tract, and blood platelets. Depending on its location, serotonin can lead to different responses. In the CNS, it regulates mood and plays a crucial role in appetite, sleep, and blood clotting. Norepinephrine, on the other hand, is often referred to as the fight or flight neurotransmitter. It stimulates the sympathomimetic system and has receptors in various parts of the body, including the CNS, blood vessels, bladder, and eyes. Norepinephrine also plays a role in anxiety, opioid withdrawal, and hypertension. The role of dopamine, the neurotransmitter of reward and pleasure, has a range of actions depending on its location in the brain or periphery. It plays a significant role in motor control, motivation, arousal, pleasure, reward, learning, and mood regulation. Additionally, it is essential in the pharmacology of antidepressants. Antidepressant pharmacology: antidepressants primarily work by increasing the release or blocking the reuptake of three key neurotransmitters, serotonin, norepinephrine, and dopamine. They have a profound impact on mood regulation, appetite, cognitive alertness, behavior, sleep, attention, pleasure, and energy. DSM-5 criteria for major depressive disorder: to diagnose major depressive disorder, 5 or more specific symptoms must be present during a 2-week period, with at least one being either a depressed mood or loss of interest or pleasure. These symptoms include changes in appetite or weight, insomnia or hypersomnia, depressed mood or irritability, decreased interest or pleasure, and more. Contributory factors. Several factors can contribute to mood disorders, including medications like beta blockers, corticosteroids, interferons, clonidine, and oral contraceptives. Conditions like multiple sclerosis, Parkinson's disease, thyroid disorders, and hypothyroidism can also play a role. Antidepressant classes. Antidepressants are classified into several categories, such as selective serotonin reuptake inhibitors, SSRIs, selective serotonin and norepinephrine reuptake inhibitors, SNRIs, tricyclic antidepressants, TCAS, monoamine oxidase inhibitors, MAOIs, and miscellaneous antidepressants like bupropion and mirtazapine. Selective serotonin reuptake inhibitors, SSRIs. SSRIs work by inhibiting the reuptake of serotonin in the synaptic cleft, thus increasing serotonin levels. They have a positive impact on mood, anxiety, sleep, and interest. However, they should not be combined with MAOIs, and discontinuation can lead to withdrawal symptoms. SNRIs and tricyclic antidepressants. SNRIs, like venlafaxine and duloxetine, inhibit the reuptake of both serotonin and norepinephrine, providing a broader effect. They share similar side effects with SSRIs, including nausea, diaphoresis, anxiety, and more. Tricyclic antidepressants also affect serotonin and norepinephrine but have additional side effects due to their action on other receptors. Monoamine oxidase inhibitors, MAOIs. MAOIs work by inhibiting the enzyme responsible for metabolizing catecholamines, thereby increasing their duration in the synaptic cleft. MAOIs have dietary restrictions and interact with various medications, including SSRIs. Miscellaneous antidepressants, bupropion and mirtazapine. Bupropion is a stimulating antidepressant that lacks some of the side effects seen with other antidepressants, making it a valuable option for some patients. Mirtazapine, on the other hand, is useful for palliative care and oncology patients, particularly in managing sleep and appetite stimulation. Just like good timber that grows stronger through challenges and storms, these neurotransmitters and antidepressant medications are crucial for helping individuals cope with mood disorders. Understanding the role of neurotransmitters in regulating our emotions is essential in the field of mental health. In closing, remember the common law of life: the stronger wind, the stronger trees, by sun and cold, by rain and snow, in trees and men, good timbers grow. In the realm of mood regulation, neurotransmitters are the building blocks of our emotional well-being, and the knowledge of their roles is essential for effective mental health treatment. The ANS, the body's silent guide so true, innervates muscles, glands, with fibers too. Though bones are not within its vast domain, sensory nerves supply its vital rein. Endocrine and autonomic systems pair, maintaining balance, care, and tender care. The brainstem and sacral parts give rise to sympathetic nerves and parasympathetic ties. Motor impulses transmission is distinct, two neurons chain the path, in fact, succinct. The first, preganglionic, in ganglious seat, the second, postganglionic, brings the heat. Catecholamines in play, they fuel the drive, from Ne to AP, they help us thrive. In vesicles, they're stored until they're needed, a calcium influx, secrets then conceded. Adrenergic receptors, alpha and beta split, alpha 1 leads to calcium's critical fit. Alpha 2 inhibits, causing a decrease in feedback loops, the system finds its peace. Beta 1 mediates the heart's own beat, adenylate cyclase, it can't defeat. Beta 2, favored by epinephrine's call, relaxes vessels, wide and small. Termination occurs, with uptake of care, MAO, and COMT play a role, a pair. Cholinergic neurons, in them we confide, in muscles, nerves, and vessels they abide. Choline and acetyl, they intertwine, to form ACH, our messenger, so fine. Stored in vesicles, ready for the task, ACH's release brings answers that we ask. Cholinergic receptors, M and N, so dear, they modulate our actions without fear. Phospholipase, potassium, they sway, in the grand scheme, they lead the way. In neuromuscular junctions, they control the cation channels, opening the toll. In CNS and ganglia, their reach extends, these cholinergic systems, our body tends tell me not, in mournful numbers, of the drugs that life encumbers, fluconazole, with names so bright, candidiasis, it helps to fight. Fluocinanide, for skin so fair, plaque psoriasis, it helps repair, with atopic dermatitis, it's in the fray, to bring relief and light the way. Floxetine, Prozac's name we know, for depression and OCD, it helps us grow, panic disorder and more it tends, to mend our hearts and make amends. Fluticasone, both nasal and inhaled, allergic rhinitis and asthma's tail, it fights the woes that we endure, inhaling deeply, our health is sure. Folic acid, in the name of Pha8, megablastic anemia, it does abate, fosinapril, for the heart's desire, to heal the ills that might transpire. Furosemide, Lasix's sound so clear, edema and overload, it's here, to help the heart, and kidneys too, in their struggles to push through. Gabapentin, with Neurontin's grace, eases seizures and neuralgia's chase, Gatafloxacin ophthalmic, for eyes so bright, in bacterial conjunctivitis, it's the light. Gemfibrozil, Lopid's name proclaimed, for hyperlipidemia, it's famed, Glecaprevir / P-Brentasfer, Mayvirat's song, fights hepatitis C all along. Glympyride and glipizide in the air, against diabetes, they both declare, Guanfacine, for focus and hypertension's grip, in the world of medication, they equipment Haemophilus influenza, serotype B vaccine, ACT HIV, Hybrix, it's not routine, to prevent the invasive HIV's decree, in children's health, it's the key. Hepatitis A and B vaccines strong, Havrix, Recomivax HB, their song, preventing infections that can harm, in their protection, we find charm. Human papillomavirus vaccine, Gardasil 9's pride, preventing infections far and wide, cervical cancer, warts, and more, in its shield, we find the core. So, in the world of medicine's art, these drugs play a vital part, let us use them with care and grace, in the healing journey we embrace. Purpose of these episodes not at all, for advice or medical suggestions. These are aimed to provide support to peer pharmacists in training in educational and intellectually stimulating ways. Again, these are not at all for medical advice, or medical suggestions. Please see your local board and state certified health professional. The views of this podcast represent those of my guest, S, and I.
Note, purpose of these episodes not at all, for advice or medical suggestions. These are aimed to provide support for peer pharmacists in training in educational and intellectual stimulating ways. Again, these are not at all for medical advice, or for medical suggestions. Please see your local state and board certified physician, PA or NP, and pharmacist for medical advice and suggestions. The views in this podcast represent those of my guest, S, and I. Top 300 drugs and their indications. 1 Lortab, hydrocodone/acetaminophen opioid. Pain. 2 Vicodin, hydrocodone/acetaminophen opioid. Pain. 3 Lorcet, hydrocodone/acetaminophen opioid. Pain. 4 Norco, hydrocodone/acetaminophen opioid. Pain. 5 Synthroid, levothyroxine. T4. Hypothyroidism. 6 Levoxyl, levothyroxine T4. Hypothyroidism. 7 Levothyroid, levothyroxine T4. Hypothyroidism. 8 Prinival, lisinopril. ACI. Hypertension/proteinuria. 9 Zestrol, lisinopril ACI hypertension/proteinuria. 10 Xanax, alprazolam benzo. Anxiety. 11 Fortamate, metformin biguanide. Diabetes. 12 Glumetza, metformin biguanide. Diabetes. 13 Glucophage, metformin biguanide. Diabetes. 14 Lasix, furosemide loop diuretic hypertension/edema. 15 Prilosec, omeprazole. PPI GERD. 16 Zocor, simvastatin HGM-CoA reductase inhibitor dyslipidemia. 17 Livalo, pitavastatin HGM-CoA reductase inhibitor dyslipidemia. 18 Lescal, fluvastatin HGM-CoA reductase inhibitor. Dyslipidemia. Take at bedtime. 19 Lipitor, atorvastatin HGM-CoA reductase inhibitor dyslipidemia. 20 Norvasc, amlodipine DHP calcium channel blocker hypertension. 21 Prevental, albuterol short-acting beta agonist rescue inhaler. 22 Ventolin, albuterol short-acting beta agonist rescue inhaler. 23 Proair, albuterol short-acting beta agonist rescue inhaler. 24 Ambien, zolpidem imidazopyridine sleep. 25 Celexa, citalopram. SSRI anxiety/depression. 26 Hydrodiurol, hydrochlorothiazide diuretic. Hypertension. 27 Neurontin, gabapentin. GABA analog. Nerve pain epilepsy. 28 Zantac, ranitidine H2RA. GERD. 29 Ultram, tramadol central acting analgesic pain. 30 Bayers, aspirin. NSAID pain/inflammation/antiplatelet. 31 Ecitrin, aspirin. NSAID. Pain/inflammation/antiplatelet. 32 K-dur, potassium supplement potassium. Low potassium. 33 Clercon, potassium supplement potassium. Low potassium. 34 Clonopin, clonazepam. Benzo. Anxiety/depression. 35 Coumadin, warfarin anticoagulant. 36 Yantovan, warfarin anticoagulant. 37 Singulair, montelukast. Oral leukotriene receptor antagonist asthma/respiratory/also seasonal allergic rhinitis. 38 Low pressor, metoprolol tartrate selective BB. Hypertension/HF. 39 Amrix, cyclobenzaprine muscle relaxant. Muscle relaxer. 40 Flexeril, cyclobenzaprine muscle relaxant. Muscle relaxer. 41 Fexmid, cyclobenzaprine muscle relaxant. Muscle relaxer. 42 Seroquel, quizapine fumarate atypical antipsychotics schizophrenia/bipolar. 43 Plavix, clopidogrel. Antiplatelet. Stroke prevention. 44 Oxycontin, oxycodone opioid. Pain. 45 Deserol, trazodone tetracyclic antidepressant. Labeled for depression but usually sedative off-label. 46 Coreg, carvedilol. 47 Mevacor, lavastidine HMO-CoA reductase inhibitor dyslipidemia. 48 Zoloft, sertraline. SSRI. Anxiety/depression. 49 Cymbalta, duloxetine. SNRI anxiety/depression. 50 Percocet, Roxyset, Endocet, oxycodone/acetaminophen CII opioid. Pain. 51 Advair, fluticasone propionate/salmeterol zinaphote bronchodilator. Asthma/COPD. 52 Lantus, insulin glargine, rDNA origin, insulin. Diabetes. 53 Toujeo, insulin glargine, rDNA origin, insulin. Diabetes. 300 units/ml. 54 Simlin, Simlin-Pen, pramlintide analog of amylin hormone diabetes. Do not give if skip a meal. 55 Toprol XL, metoprolol succinate cardioselective BB. HTN. 56 Zebeta, bisoprolol. 57 Zithromax, Zmax, azithromycin macrolide. Bacterial infections. 58 Prozac, Floxidin. SSRI. Anxiety/depression. 59 Effexor, venlafaxine. SNRI anxiety/depression/nerve pain. 60 Tenormin, atenolol cardioselective BB-HTN. 61 Eleval, amitriptyline. SNRI. Anxiety/depression/nerve pain. 62 Combivent, ipratropium bromide/albuterol sulfate, MDI, COPD asthma. 63 Wellbutrin, bupropion. Norepinephrine dopamine reuptake inhibitor antidepressant/smoking aid. 64 Zyban, bupropion. Norepinephrine dopamine reuptake inhibitor antidepressant/smoking aid. 65 Nexium, esomeprazole. PPI GERD. 66 Ativan, lorazepam benzo anxiety/panic attacks. 67 Tricor, fenofibrate fibrate dyslipidemia/triglycerides. Take with food cc. 68 Lexapro, escitalopram. SSRI anxiety/depression. 69 Flonase, fluticasone propionate nasal corticosteroid. Nasal congestion. 70 Deltasone, prednisone. Steroid. Inflammation/allergy/immunosuppression. 71 Depakote, D-valprox valproic acid seizure/bipolar. 72 Catapres, clonidine alpha agonist hypertension/sedative/ADHD. 73 Aldamet, methyl-dopa alpha agonist hypertension. 74 Cardizem, diltiazem. CCB. HTN and angina. 75 Karsha, diltiazem. 76 Tiazac, diltiazem. CCB. HTN and angina. 77 Soma, carisoprodol carbamate. Muscle relaxer. 78 Risperdal, risperidone atypical antipsychotic schizophrenia/antipsychotic. 79 Mobic, meloxicam. NSAID anti-inflammatory. 80 Detrol, tolterodine cholinergic incontinence. 81 Topamax, topiramate anticonvulsant seizure/nerve pain. 82 Motrin, ibuprofen. NSAID pain/inflammation. 83 Amoxil, amoxicillin trihydrate penicillin. Bacterial infection. 84 Trimox, amoxicillin trihydrate penicillin. Bacterial infection. 85 Moxitog, amoxicillin trihydrate penicillin. Bacterial infection. 86 Naproxen, naproxen. 87 Zestoretic, lisinopril/hydrochlorothiazide ACE inhibitor and thiazide diuretic. HTN. 88 Prinzide, lisinopril/hydrochlorothiazide ACE inhibitor and thiazide diuretic. HTN. 89 Reglan, metoclopramide. Prokinetic. Nacia/GERD. 90 Bactrim, sulfamethoxazole/trimethoprim sulfur antibiotic. Bacterial infection. 91 Septra, sulfamethoxazole/trimethoprim sulfur antibiotic. Bacterial infection. 92 Actose, pioglitazone. Thiazolidinediones. Diabetes. 93 Abilify, aripiprazole atypical antipsychotic schizophrenia/antipsychotic. 94 Fosamax, alendronate bisphosphonate osteoporosis. 95 Spiriva, Shiotropium bromide inhalation bronchodilator. COPD. 96 Flomax, Tamsulosin. Alpha blocker. BPH. 97 Lyrica, pregabalin anticonvulsant nerve pain. 98 Micronase, glyburide sulfonylurea. diabetes. 99 diabeta, glyburide sulfonylurea diabetes. 100 Aricept, donepezylcholinesterase terrace inhibitor Alzheimer's. 101 Crestor, rosuvastatin HGMO-CoA reductase inhibitor dyslipidemia. 102 Valium, diazepam benzo anxiety/panic attacks. 103 Aldactone, spironolactone potassium sparing diuretic. HFHTN. 104 Inspra, eplerenone potassium sparing diuretic. HFHTN. 105 Bistol each, nebivolol. 106 Texturna, aliskiren and HCDZ. 107 Volturna, aliskiren and valsartan. 108 Protonix, pantoprazole. 109 Lamictal, lamotrigine antiepileptic. Seizure. 110 Copinex, lavalbuterol. Laba asthma/COPD. 111 Glucotrol, Glucotrol XL, glipizide. Sulf diabetes. 112 Allegra, fexofenadine antihistamine. Hives itching allergy. 113 Pravachol, pravastatin. HGMO-CoA reductase. Dyslipidemia. 114 Premarin, estrogens conjugated cream estrogen. Menopause. 115 Imdur, ISMO, isosorbide mononitrate nitrate. Angina HTN. 116 Monokete, isosorbide mononitrate nitrate. Angina HTN. 117 Iserdil, dilatrate, isosorbide dinonitrate nitrate. Angina HTN. 118 Cipro, ciprofloxacin. Fluoroquinolone. Bacterial infection. 119 Diazide, triamterene/hydrochlorothiazide diuretic. HTN. 120 Maxide, triamterene/hydrochlorothiazide diuretic. HTN. 121 Phenergan, promethazine. Antihistamine. Allergies, pain, nasiat. 122 Xyloprim, allopurinol xanthine oxidase inhibitors gout. 123 Nitrostat, nitroglycerin nitrates. Angina. 124 Nitroquick, nitroglycerin nitrates. Angina. 125 Prevacid, lansoprazole. PPI GERD. 126 Paxil, paroxetine. SSRI. Anxiety/depression. 127 Pexiva, paroxetine. SSRI anxiety/depression. 128 Vibramycin, doxycycline high-clat tetracycline antibiotics. Bacterial infection. 129 Vibratabs, doxycycline high-clat tetracycline antibiotics. Bacterial infection. 130 Adderall, amphetamine/dextroamphetamine salts CII amphetamine. ADHD. 131 Novolog, insulin aspart, rDNA origin. Insulin. Diabetes. 132 Namenda, memantine NMDA receptor blocker Alzheimer's. 133 Duragesic, fentanyl transdermal opioid. Chronic pain. 134 Remeron, mirtazapine. SNRI. Anxiety/depression. 135 Zacia, ezetimibe cholesterol absorption inhibitor dyslipidemia. 136 Celebrex, Celecoxib. NSAID pain/inflammation. 137 Diovan, valsartan angiotensin reductase inhibitor. HTN. 138 Atarax, hydroxyzine HCl, ODC, antihistamine. Sleep, itching allergy anxiety. 139 Unisom, doxylamine antihistamine. Sleep. 140 Inderal, propranolol non-selective BB hypertension/HF. 141 Brevibloc, esmolol. 142 Inopran XL, propranolol non-selective BB hypertension/HF. 143 Lanoxin, digoxin cardiac glycoside arrhythmia and HF. 144 Lanoxicaps, digoxin cardiac glycoside arrhythmia and HF. 145 Digitec, digoxin cardiac glycoside arrhythmia and HF. 146 Drisdol, vitamin D2, ergocalciferol inactive vitamin D. Bone health. 147 Ricotrol, vitamin D3, calcitriol active vitamin D. Bone health. 148 Amaryl, glympyride. Sulfuria. Diabetes. 149 Prandin, repaglinide miglatinides. Rapid-acting glinides. 150 Starlix, nateglinide miglatinides. Rapid-acting glinides. 151 Vitarin, izatimib/simvastatin cholesterol absorption inhibitor and HGMO-CoA cholesterol. 152 Folate, folic acid. Folic acid deficiency/megaloblastic anemia. 153 Folacin, folic acid B vitamin. Folic acid deficiency/megaloblastic anemia. 154 Pteroyl glutamine acid, folic acid B vitamin. Folic acid deficiency/megaloblastic anemia. 155 Keflex, cephalexin monohydrate cef antibiotic. Bacterial infection. 156 Vasotec, enalapril maleate. ACI. HTN. 157 Buspir, buspirone azapirone. Anxiety. 158 Tegretol, carbamazepine antiepileptic. Seizure/nerve pain. 159 Carbatrol, carbamazepine antiepileptic. Seizure/nerve pain. 160 Ecatrol, carbamazepine antiepileptic. Seizure/nerve pain. 161 Cozar, losartan potassium. ARB-HTN. 162 Ritalin, methylene, metadate, methylphenidate phenethylamine and piperidine. ADHD. 163 Ditropan, oxybutynin chloride, oral, antispasmodic. Overactive bladder. 164 Ms Contin, morphine sulfate extended release opioid. Pain. 165 Slow Fe, ferrous sulfate. Iron. Anemia. 166 Lidoderm, lidocaine transdermal amide local anesthetic. Pain for local area. 167 Niferex, iron polysaccharide. Iron. Anemia. 168 Cinemet, carbidopa/levodopa dopaminergic agent. Parkinson's. 169 Duopa, carbidopa/levodopa dopaminergic agent. Enteral suspension. 170 Riteri, carbidopa/levodopa dopaminergic agent. CAP. 171 Stalevo, levodopa/carbidopa and entacapone, Compton. 172 Xanaflex, tizanidine. Centrally acting ±2 adrenergic agonist. Muscle spasms muscle relaxant. 173 Lyresil, baclofen muscle relaxant. 174 Isoptin, verapamil non-DHP-CCB. HTN, angina. 175 Calin, verapamil non-DHP-CCB HTN, angina. 176 Verolen, verapamil non-DHP-CCB. HTN, angina. 177 Requip, ropinrole dopamine agonist Parkinson's. 178 Scalaxin, metaxalone muscle relaxant. Muscle relaxer, pain. 179 Restoril, temazepam benzo. Anxiety. 180 Bentyl, dicyclamine gut antispasmodic. IBS. 181 Serux, oxazepam benzo. Anxiety. 182 Vistarol, hydroxyzine pamoate antihistamine. Anxiety itching. 183 Dilantin, phenytoin sodium extended anticonvulsant. Seizure. 184 Capsules, phenytoin sodium extended anticonvulsant. Seizure. 185 Diovan HCT, valsartan / hydrochlorothiazide ARB plus thiazide. HTN. 186 Diflucan, fluconazole. Antifungal. 187 Humulin, insulin diabetes. 188 Flovent, fluticasone propionate inhalation steroid and decongestant. 189 Lotrel, amlodipine / benazepril. 190 Xforge, amlodipine / valsartan. CCB / ARB HTN. 191 Azor, amlodipine / olmesartan. CCB / ARB HTN. 192 Phenaphan with codeine, acetaminophen / codeine. Pain. 193 Tylenol No. 3, acetaminophen / codeine. Pain. 194 Trileptal, oxcarbazepine anticonvulsant. Seizure. 195 Lithinate, lithium carbonate mood stabilizer. Bipolar disorder. 196 Lithotabs, lithium carbonate mood stabilizer. Bipolar disorder. 197 Lithobid, lithium carbonate mood stabilizer. Bipolar disorder. 198 Mirapex, pramipexole dihydrochloride dopamine agonist. Parkinson's and restless leg. 199 Nistop, Nistadin topical. Antifungal. Fungal infection. 200 Nasonex, mometasone furoate monohydrate intranasal nasal congestion / allergic rhinitis. 201 Augmentin, amoxicillin / clavulinate potassium bacterial infection. 202 Estrace, estradiol. Menopause. 203 Lotensin, benazepril. ACI. HTN. 204 Tessalin, benzonatate antitussive. Cough. 205 Kenalog, triamcinolone acetonide topical corticosteroid. Itching / rash. 206 Altase, ramipril. ACI. 207 Levaquin, levofloxacin fluoroquinolone. Bacterial infection. 208 Keppra, levetiracetam antiepileptic. Seizure. 209 Geodon, ziprasidone antipsychotic. Always take with food, similar to lurasidone. 210 Latuda, lurasidone antipsychotic. Always take with food, similar to ziprasidone. 211 Fanapt, eloperidone. Antipsychotic. Same QT prolongation risk as ziprasidone. 212 Prolixin, flufenazine first generation antipsychotic. If decanoate is the salt, 2 to 4 weeks. 213 Humalog, insulin lispro, rDNA origin diabetes. 214 Methodos, methadone. Pain / opioid withdrawal. 215 Apidra, insulin glycine diabetes. 216 Lopid, gemfibrozil fibrate cholesterol / triglyceride. Take 3 hours before breakfast and dinner. 217 Benicar, olmesartan midoxamil. 218 Fioricet, butalbital / acetaminophen / caffeine migraine. 219 Medrol, methylprednisolone. Steroid. Inflammation / rash / allergies. 220 Pepsid, famotidine H2 blocker. GERD. 221 Lunsta, esopiclone sedative. Insomnia. 222 Ultracet, tramadol / acetaminophen. Pain. 223 Trexal, methotrexate. Daily for cancer, weekly for RA. 224 Januvia, sitagliptin DPP4 inhibitors diabetes. 225 Cardura, doxazosin. Plus or minus 1 selective alpha blocker. 226 Javicinc, sitagliptin and simvastatin. 227 Janumet, sitagliptin and metformin. 228 Minipress, prazosin. Plus or minus 1 selective alpha blocker. BPH and HTN. 229 Hitrin, terazosin. Plus or minus 1 selective alpha blocker. 230 Benicar HCT, olmesartan midoxamil hydrochlorothiazide ARB and thiazide. HTN. 231 Actinol, risdronate. Bisphosphonate. Osteoporosis. 232 Imitrex, sumatriptan migraine. 233 Lomotil, diphenoxylate atropine centrally active opioid. Diarrhea. 234 Antivert, Dramamine, meclizine nausea. 235 Cogentin, benztropine Parkinson's. 236 Feldene, piroxicam. NSAID. Anti-inflammatory pain. 237 Clethodim, clindamycin oral lincosamide. Bacterial infection. 238 Zovirax, acyclovir herpes, shingles chickenpox. 239 Procardia, nifedipine. DHPCCBHTN. 240, nifedipine, nifedipine. DHPCCBHTN. 241 Otalat, nifedipine. DHPCCBHTN. 242 Bumex, bumetanide diuretic HTN. 243 Vesicare, sulfasalazine bladder relaxant overactive bladder. 244 Acupril, quinapril. ACE. HTN. 245 Trivara, trifazole, Inpress, levonorgestrel /ethinyl estradiol contraceptive. 246 Avandia, rosiglitazone. Thiazolidinediene. Diabetes. 247 Phenergan with codeine, promethazine codeine cold medicine. Opioid with HH1 antihistamine. 248 Glucovance, glyburide metformin. Sulf and biguanide. Diabetes. 249 Novolin 70/30ths, insulin Novolin diabetes. Insulin. 250 Metaglip, glipizide metformin sulf and biguanide. Diabetes. 251 Tricycline, tricycline low, trisprintac, Trinessa, norgestimate ethinyl estra. Diol contraceptive. 252 Zyprexa, olanzapine. Schizophrenia antipsychotic. 253 Yasmin, Ocella, drospirenone ethinyl estradiol birth control. 254 Voltaren, diclofenac sodium oral, can also be gel for pain. NSAID. Anti-inflammatory and pain. 255 Agrenox, dipyridamole aspirin. Antiplatelet to prevent stroke. 256 Boniva, ibandronate bisphosphonate osteoporosis. 257 Compazine, prochlorperazine phenothiazine class antipsychotic, anti-nausea and anxiety. 258 Compro, prochlorperazine phenothiazine class antipsychotic, anti-nausea and anxiety. 259 Bactroban, mupirocin. Antibiotic for skin infections. 260, Macrodantin, nitrofurantoin and antibiotic for UTI. 261 Furidantin, nitrofurantoin and antibiotic for UTI. 262 Macrobid, nitrofurantoin and antibiotic for UTI. 263 Lotrazone, clotrimazole betamethasone dipropionate steroid antifungal. It can treat fungal infections. 264 Flagyl, metronidazole. Antibiotic. 265 Robaxin, methocarbamol muscle relaxant. It can treat muscle spasms and pain. 266 Tussionex, chlorpheniramine/hydrocodone antihistamine/narcotic and narcotic. It can treat cough. 267 Evista, raloxifene. Estrogen modulator. Osteoporosis. 268 Provigil, modafinil stimulant for narcolepsy. 269 Nuvigil, are modafinil stimulant for narcolepsy. 270 Carafate, sucralfate antacid. It can treat ulcers. 271 Enablx, darafenicin overactive bladder. 272 Nispan, niacin. Cholesterol medication and vitamin. It can treat high cholesterol and triglyceride levels as well as niacin deficiency. 273 Astelin, azelastine nasal itchy stuffy runny nose. 274 Relafin, nabumetone NSAID, anti-inflammatory, it can treat pain and arthritis. 275 Valtrax, valacyclovir herpes shingles, chicken pox. 276 Armour thyroid, Desicat, T3 and T4 hypothyroid. 277 Zofran, ondansetron. Nausea/vomiting. 278 Acefex, rabeprazole. PPI GERD. 279 Sinequin, doxepin. TCA anxiety/depression. 280 Theocron, Theo24, theophylline anhydrous asthma, emphysema COPD. 281 Chantix, varenicline tartrate. Smoking cessation. 282 Dimoptic, timolol maleate ophthalmic non-selective BB. 283 Betopic, betaxolol. Ophthalmic. Selective BB. 284 Ocupress, cartiolol ophthalmic selective BB. 285 Omnicef, cefdinir. Antibiotic. 286 Levemir, insulin detemir diabetes. 287 Pristic, disvenlafaxine antidepressant. 288 Biota, exenatide. GLP-1 agonist. Diabetes. 289 Lavazza, omega-3 acid ethyl esters triglyceride. 290 Mycardis, telmisartan. ARB. HTN. 291 Zalatan, latanoprost glaucoma. 292 Stratera, atomoxetine. SNRI ADHD. 293 Vedids, Pen-VK, Vicillin, penicillin V potassium. 294 Pen-VK, penicillin V potassium. 295 Vicillin, penicillin V potassium. 296 Atripla, Efavirenz, emtricitabine, tenofovir disoproxyl fumarate. HIV. 297 Plaquenil, hydroxychloroquine sulfate. Malaria in third world countries, RA, and lupus in first world. 298 Xeroxilin, metolazone thiazide diuretic. 299 Thalidone, chlorthalidone thiazide diuretic. 300 Proscar, finasteride. BPH. 301 Metussin AC, codeine/guaifenicin cough. 302 Robitussin AC, codeine/guaifenicin cough. 303 Monopril, fosinapril. ACEI. HTN and HF. 304 Prem-Pro, estrogen, conjugated, /medroxyprogesterone acetate estrogen replacement therapy for hot flashes caused by menopause. 305 Patanol, olopatadine ophthalmic. Eye allergic conjunctivitis. 306 Pataday, olopatadine ophthalmic eye allergic conjunctivitis. 307 Mavic, Trandolapril. ACIHTN. 308 Viveldot, estradiol topical hormone replacement. 309 Luminol, phenobarbital barabuate. Sedative. 310 sulfaton, phenobarbital barabuate. Sedative. 311 vicoprofen, hydrocodone/ibuprofen opioid. Pain. 312 orthocycline, Sprintec, norgestimate/ethinyl estradiol contraceptive. 313 avalide, irbesartan/hydrochlorothiazide. 314 Hizar, losartan/hydrochlorothiazide ARB and HCTC for HTN. 315 Plendil, felodipine. 316 Yaz, drospirenone/ethinyl estradiol contraceptive. 317 Pulmicort, budesonide inhalation steroid. Asthma. 318 Travatan, Travatan Z, travoprost glaucoma. 319 Zezal, levocetirizine. Antihistamine for allergy. 320 Nasacort AQ, triamcinolone acetonide intranasal allergy symptoms. 321 Loestrin FE, microgestin FE, Junal FE, norethindrone/ethinyl estradiol/ferrous fumarate. Contraceptive. 322 Adipex P, phentermine. Appetite suppression for obesity. 323 Ionamine, phentermine appetite suppression for obesity. 324 Cortisone, amiodarone potassium channel blocker antiarrhythmic. 325 Pacerone, amiodarone potassium channel blocker antiarrhythmic. 326 Nizoral, ketoconazole antifungal. 327 Avapro, irbesartan. 328 Pamelor, nortriptyline SNRI for depression. 329 Arimidex, anastrozole estrogen for cancer. 330 Avalox, moxifloxacin fluoroquinolone. 331 Tamiflu, oseltamivir flu vaccine. 332 Viagra, sildenafil citrate. Ed. 333 Apreoline, hydralazine. HTN. 334 Vivance, lisdexamphetamine dimesylate. ADHD. 335 Alphagan P, brimonidine tartrate. Glaucoma. Also it can treat facial redness caused by rosacea in its topical form. 336 Lidex, fluocinolone topical steroid. It can treat many skin disorders. It can also relieve pain, itching, and swelling of the skin. 337 Nistadin oral, Nistadin oral. This medication is used to treat fungal infections of the mouth. 338 Minicin, minocycline tetracycline antibiotic. 339 Levsin, Levbid, Levsinex, hyoscyamine gut spasmodic for IBS. 340 Levbid, hyoscyamine, gut spasmodic for IBS. 341 Levsinex, hyoscyamine gut spasmodic for IBS. 342 Chalice, tadalafil. 343 Cosopt, dorzolamide/timolol maleate/non-selective BB. 344 Pyridium, phenazopyridine. Urinary tract pain. 345 Peridex, chlorhexidine gluconate. Chlorhexidine is an antibacterial used as an antiseptic and for other applications. 346 Periogard, chlorhexidine gluconate. Chlorhexidine is an antibacterial used as an antiseptic and for other applications. 347 Lumigan, bimetoprost anti-glaucoma. It can reduce pressure inside the eye in its eye drops form. As an eyelash solution, it can help eyelashes grow. 348 Nuvaring, etonogestrol/ethinyl estradiol vaginal. Contraceptive. 349 Prometrium, progesterone oral menopause. 350 Lamisil, terbinafine. Antifungal. 351 Vigamox, moxifloxacin ophthalmic bacterial conjunctivitis. 352 Sumicin, tetracycline. Antibiotic. 353 Panmicin, tetracycline antibiotic. 354 Timovate, clobetasol propionate topical steroid itching redness. 355 Provera, medroxyprogesterone acetate contraceptive or endometrial pain. 356 Overal, low/overal, ogestrol, Cries-L, norgestrol with ethinyl estradiol contraceptive. 357 Biaxin, clarithromycin, macrolide antibiotic. 358 Dmadex, torsemide diuretic. Edema or HTN. 359 Indocin, indomethacin NSAID, anti-inflammatory, it can treat pain. 360 Atacand, candesartan Celex-etyl arb for HTN. 361 Allegra D, fexofenadine/pseudoephedrine allergy and congestion. 362 Normadine, labetalol, non-selective BB, HTN. 363 Trandate, labetalol non-selective BB, HTN. 364 Rest ASIS, cyclosporin emulsion ophthalmic, immunosuppressive agent used to treat chronic dry eye caused from inflammation. 365 Mycardis HCT, telmisartan/hydrochlorothiazide ARB plus thiazide for HTN. 366 Tenoretic, atenolol with chlorthalidone cardioselective BB plus diuretic. 367 Mycolog 2, nistidine/triamcinolone acetonide fungal skin infection and inflammation caused by it. 368 Desogen, Apri, Orthocept, desogestrol with ethinyl estradiol contraceptive. 369 Orapred, prednisolone sodium phosphate. Inflammation, multiple sclerosis, and arthritis. 370 Zymer, gatafloxacin ophthalmic bacterial conjunctivitis. 371 Levitra, vardenafil. Ed. 372 Staxin, vardenafil. Ed. 373 Suboxone, buprenorphine/naloxone opioid withdrawal. 374 Decadron, dexamethasone oral. Inflammation, allergic reactions, and flare UPS of ulcerative colitis. 375 Veramist, fluticasone furoate nasal allergy, congestion, sneezing, itching. 376 Ciprodex, ciprofloxacin/dexamethasone otic treat outer ear infections. 377 Focalin, dexmethylphenidate. 378 Lotensin HCT, benazepryl/hydrochlorothiazide ACE and thiazide for HTN. 379 Elocon, momtasone furoate topical. Eczema, psoriasis, allergies, and rash. 380 Clarinex, desloratadine antihistamine. It can treat or prevent hives, allergy symptoms. 381 Nolvadex, tamoxifen citrate. 382 Duoneb, ipratropium bromide with albuterol sulfate solution bronchodilator. It can treat COPD. 383 Concerta, methylphenidate. 384 Oxy-IR, oxycodone IR opioid. Pain. 385 Roxicodone, oxycodone IR opioid. Pain. 386 Miralax, polyethylene glycol 3350, NF osmotic laxative. 387 Glycolax, polyethylene glycol 3350, NF osmotic laxative. 388 Zyac, bisoprolol/hydrochlorothiazide selective BB/thiazide diuretic. HTN. 389 Loestrin 24Fe, norethindrone acetate, ethinyl estradiol, ferrous fumarate contraceptive. 390 Calcris, colchicine. 391 Avodart, dutasteride. BPH. 392 Ceftin, cefuroxime-acetyl oral cef antiobic. 393 Ales, Aviane, levonorgestrol with ethinyl estradiol contraceptive. 394 Mercet, Carava, Desogestrel with ethinyl estradiol contraceptive. 395 Nikon 135th, Orthonovum 135th, norethindrone and ethinyl estradiol contraceptive. 396 Prevnar, pneumococcal vaccine. 397 Lupron, Luprolide. GnRH agonist. Prostate cancer. 398 Zolacard, Gosrelin GnRH agonist prostate cancer. 399 Zytiga, abiraterone androgen biosynthesis inhibitors, prostate cancer. 400 Cazadex, bicalutamide first generation anti-androgen prostate cancer. 401 Firmagon, digorilix GnRH antagonist, prostate cancer. 402 Ranaxa, ranolazine. Add-on therapy for stable angina. Reduce oxygen demand, reduce number of attacks. 403 Nimotop, nimodipine non-DHP-CCB hemorrhagic stroke. 404 Cardine, nicardipine. CCB. 4 hypertensive therapy in ischemic stroke patient, labetalol is other option. 405 Osmitrol, mannitol hemorrhagic stroke. 406 Invokana, canagliflozin SGLT2. Diabetes. 407 Farxiga, dapagliflozin SGLT2. Diabetes. 408 Jardiance, empagliflozin SGLT2. Diabetes. 409 Precose, acarbose alpha glucosidase inhibitor diabetes. No meal, no drugs. 410 Glycet, miglitol. Alpha glucosidase inhibitor. Diabetes. No meal, no drugs. 411 Envirase, Scarinavir mesylate not Scarinavir soft gel capsule. Sources for this episode include WHO publications, drug manuals, medicine handbooks, journals and compendium. Pharmacology, basics. 1. Pharmacology, body of knowledge concerned with the actions of chemicals on biological systems. 2. Medical pharmacology, use of chemicals in prevention, diagnosis and treatment of disease. 3. Toxicology, concerned with undesirable effects of chemicals on biological systems. 4. Pharmacokinetics, what the body does to the drug, absorption, distribution, metabolism, excretion. 5. Pharmacodynamics, what the drug does to the body. 6. Onset of action, how much of drug comes into circulation to produce effect, determined by route of administration and drug dosage. When you increase drug dosage, the concentration of drug in the blood will also increase. 7. Duration of action is affected by drug dosage, higher the dosage. Rate of distribution. Rate of metabolism. Rate of excretion. 4. Minimum effective concentration, amount of drug required to produce a therapeutic effect. 5. Duration of action, time between the rise to the decline at minimum effective concentration for therapeutic effect. 6. Mechanism of drug action, drug cannot produce any new action in the body, can act on enzymes, ion channels, upregulate or downregulate a system within the body. Effect physiology on the cells but do not produce new actions in body. 15. Ligands, signal molecules. 16. Ra, receptor existing in an active state. 17. Ri, receptor existing in an inactive state. 18. External receptor site, ligand binds outside plasma membrane and produces change inside the cell. 19. Internal receptor site, drug goes inside the cell, binds to receptor inside the cell, moves to nucleus, to produce desired effect. 20. Mechanisms of agonist-mediated activation, ion channels. G protein-coupled receptors. Receptor tyrosine kinase. Intracellular hormone receptors. 17. Ion channel, ligand-gated voltage-gated. Second messenger regulated. 1/6. Pharmacology, basics. 18. Ligand-gated ion channel, drug binds to ion channel, activating it to open, sodium enters triggering an action potential. 19. Voltage-gated ion channel, Change in charge, potential, between inside the cell and outside the cell causes the channels to open to maintain internal homeostasis. Inside the cell the charge is between -70 MV to -90 MV to open the gate to maintain internal homeostasis. 20-second messenger regulated, various second messengers that regulate certain channels by opening and closing them. Calcium, CAMP. CAMP cause activation of enzyme which triggers signal transduction pathway. 21G protein coupled receptors, a signal receptor protein in the plasma membrane that responds to the binding of a signaling molecule by activating a G protein. Also called a G protein linked receptor. 22 receptor tyrosine kinases. 1. Insulin binds to tyrosine kinase receptor. 2. Tyrosine kinase receptor undergoes autophosphorylation. 3. Insulin receptor is activated. 4. Downstream cascade of signals. 5. Final signal is to recruit glucose transporters, GLUT, move from cytosol to plasma membrane and take glucose into tissues for utilization or storage. 23 3-amino acid with hydroxyl groups, serine, tyrosine, threonine. 24 kinase, enzyme that causes phosphorylation. 25 intracellular hormone receptor, mostly steroids, enter the cell easily because they are lipids, bind to receptors inside the cell in the cytoplasm, get activated, move to nucleus, cause DNA transcription, which leads to the formation of particular proteins. 26 affinity, measure of tightness in which a drug binds to a receptor. 27 intrinsic activity, ability of a drug to activate a receptor upon binding. 28 agonist, a drug that mimics the action of endogenous ligand. 29 primary agonist, drug binds to the same recognition site as the endogenous agonist. 30 orthosteric site, primary binding site. 31 allosteric agonist, bind to a different region on the receptor. 32 antagonist, drugs that block or reduce the activity of the agonist, have affinity but no intrinsic activity. 33 syntopic interaction, competition with agonist for the same/overlapping site. 2/6. Pharmacology, basics. 34 physical antagonist, physically interacts and nullifies the action of the drug X, charcoal, good absorbent, binds to alkaloid to form a complex and will be excreted. 35 chemical antagonist, drug forms compounds with other substances like Ca and Mg. X, tetracycline binds with Ca in milk and then will be eliminated. 36 physiological antagonist, a drug that counters the effects of another by binding to a different receptor and causing opposing effects. Drug that produces an opposite action by binding to a different receptor. X, adrenaline is a physiological antagonist to histamine because adrenaline causes bronchodilation and histamine causes bronchoconstriction. 37 pharmacological antagonist, drug that binds to receptor and produces no effect, shows no intrinsic activity. 38 partial agonist, a drug that binds to a receptor and causes a response that is less than that caused by a full agonist. 39 inverse agonist, in the stomach histamine receptors are constitutively activated without a stimulus, so under normal conditions they are operating at 20%. Inverse agonist inhibits these receptors, bringing them down to 0%. 40 competitive agonist, same binding site as agonist, resembles chemically with agonist, right shift on the dose-response curve, response depends on concentration. 41 non-competitive agonist, different binding site of agonist, not resembled chemically, downward shift of DRC, increasing agonist concentration won't make a difference. 42 How do we activate receptor site? 1. Open or close ion channels. 2. Speed up or slow down transporters. 3. Increase or decrease enzyme activity. 43 Efficacy, maximum effect a drug can produce, can be measured with a graded dose-response curve. 44 Potency, amount of drug needed to produce a given effect. Determined by affinity of the receptor for the drug. 45 EC50, the dose required for an individual to experience 50% of the maximum effect. 46ED50, dose required to produce a therapeutic effect in 50% of the population, median effective dose. 47 Therapeutic index, a ratio that compares the blood concentration at which a drug becomes toxic and the concentration at which the drug is effective. Pharmacology, basics. LD50/ED50. 10:1 safer drug because it has wider therapeutic index. 3:1 more dangerous drugs, needs more attention because the therapeutic index is narrow. 48 LD50, median lethal dose. 49 Tolerance, reduced response to a drug after prolonged use, develops gradually over a long period of time. X. Alcoholics needs more alcohol on the second day to feel the same effect from the first. Liver is accustomed to alcohol so the enzymes are ready. 50 Pharmacokinetic tolerance, enhanced enzymatic breakdown reduces the amount of drug reaching its site of action. X. Barbiturates, carbamazepine, induce their own metabolism, autometabolism, autodestruction, on frequent repeated use. 51 Pharmacodynamic tolerance, tolerance caused by altered nervous system sensitivity, change in receptors. Action of drug is reduced because of downregulation of receptors, meaning that receptor expression or the amount of receptor present will be less, receptor is not as active as before. Or desensitization of receptors, meaning that receptors will not function as well. Proteins could go through post-translation modification, meaning that they will lose, for example, a sulfide due to drug use losing their function. Some changes are reversible, others are not. And that internalization of receptors, so receptor will not be available. An exhaustion of mediators, depletion of catecholamine, norepinephrine. 52 Natural inherent tolerance, genetic makeup makes an individual resistant or will have more response to a drug. 53 Acquired tolerance, occurs on repeated use of drug. X. Tolerance develops to sedative action of chlorpromazine but not to its anti-seizure action. Pharmacology, basics. Tolerance occurs to sedative action of phenobarbital but not to its anti-epileptic action. 54 Cross-tolerance, development of tolerance to pharmacologically related drugs. X. Partial tolerance between morphine and barbiturates. Complete cross-tolerance between morphine and pethidine, same drug class. 55 Tachyphylaxis, type of tolerance that occurs rapidly within minutes or seconds, only takes a small concentration of drug to cause this. 56 Low, narrow, therapeutic index drugs, acetaminophen, theophylline, carbamazepine, digoxin, warfarin, lithium, phenytoin, gentamicin, vancomycin. Antidepressants, tricyclic, insulin. 57 High, wide, therapeutic index drugs, NSAIDs benzodiazepines. Most antibiotics furosemide. SSRI. 58 Nitroglycerin, can cause tolerance. As pharmacist you must tell the PT they need to have a 10 to 12 nitrate-free period to prevent tolerance. Causes vasodilation. 59 Synergism, one drug is going to have an additive effect with another drug, increasing efficacy. Action of one drug is facilitated or increased by another drug. Or when one drug is inactive alone but active when combined with another. 60 Additive, effect of two drugs in the same direction. X. Amlodipine. Pharmacology, basics. 61 Amlodipine and atenolol, antihypertensive. Amlodipine is a calcium channel blocker and atenolol is a beta blocker. Both work to reduce hypertension and act on different places in the heart. 62 Glibenclamide and metformin, hypoglycemic. Glibenclamide is a sulfonylurea that increases insulin receptor sensitivity and causes secretion of insulin, acts on pancreas. Metformin acts on liver to control blood glucose level. 63 Superadditive, potentiation effect of the combination is greater than the individual effects of each component. 64 Acetylcholine and physostigmine, acetylcholine acts on muscle to produce effect, physostigmine is inactive. Both are degraded by acetylcholinesterase. When acetylcholine is alone, the enzyme will break it down quickly. When you have physostigmine with it, the enzyme doesn't know which one to attack. Competition between the two, so it increases the duration of acetylcholine. 65. Levodopa and carbidopa. Levodopa treats Parkinson's disease by converting to dopamine to prevent movement disorder. When taken orally, levodopa is converted to dopamine in the intestine, causing adverse effects like nausea, vomiting. Give it with carbidopa, which prevents the breakdown in the intestines so that it can be transported to the brain, cross the BBB, where it can be converted to dopamine to act on the basal ganglia. 66. Sulfamethoxazole/trimethoprim inhibits two enzymes in formation of tetrahydrofolic acid, which is required for bacterial cell wall synthesis. If you want to kill the bacteria, you need sulfamethoxazole to prevent the conversion of PABA to an intermediate product, and then you need trimethoprim to prevent the conversion of the intermediate product to tetrahydrofolic acid. 67. Enalapril/hydrochlorothiazide, enalapril, angiotensin converting inhibitor, hydrochlorothiazide, diuretic. Acts on two different places to produce antihypertensive effect. Drug stems. ANAB for angiogenesis inhibitors, e.g. pazopanib. Anseron. Anseron for serotonin receptor antagonists, especially 5-HT2 antagonists, e.g. ritonseron and mianseron. ANT for various receptors antagonists, e.g. adacaprant and rimonabant. ARIT for anti-arthritic agents, e.g. lobenzarit. ASE for enzymes, e.g. alteplase. Azepam. Azepam or azalam for benzodiazepines, e.g. diazepam and alprazolam. Caine for local anesthetics, e.g. procaine or cocaine. Caine for class I antiarrhythmics, e.g. procainamide. Coxib for COX-2 inhibitors, a type of anti-inflammatory drugs, e.g. celecoxib. MAB for monoclonal antibodies, e.g. infliximab. See nomenclature of monoclonal antibodies. NAB for cannabinoid receptor agonists, e.g. cannabidiol citation needed dronabinol. NABANT for cannabinoid receptor antagonists. NAVER for antiretroviral protease inhibitors, e.g. darunavir. ALOL for beta blockers, e.g. atenolol. PRIL for ACE inhibitors, e.g. captopril. Sartan for angiotensin II receptor antagonists, e.g. losartan. Tynab for tyrosine kinase inhibitors, e.g. imatinib. Vastatin for HMG-CoA reductase inhibitors, a group of cholesterol-lowering agents, e.g. simvastatin. VIR for antivirals, e.g. acyclovir or ritonavir. ARTE for artemisinin antimalarials, e.g. artemether. CEPH for cephalosporins, e.g. cephalexin. IO for iodine-containing radiopharmaceuticals, e.g. iobenguan. VEC for gene therapy vectors, e.g. ilipogene tiparvovec. Marin for messenger RNA products, e.g. tozonameran. Medication errors. What is a medication error? First, an error is an unintended act or an act that does achieve its intended outcome. Medication errors may be defined as any preventable actions that may contribute to the inappropriate or harmful use of a medicine by a patient. Why do medication errors occur? Medication errors may be defined as any preventable action that may contribute to the inappropriate or harmful use of a medicine by a patient. And they may occur due to the lack of focus, and concentration may be due to distractions and interruptions in a busy pharmacy. And they may occur when prescriptions and medication order are not clearly written. And also, they may occur due to the misuse and misinterpretation of abbreviations. What are the 5 rights of safe medication use? 1. The right patient. 2. The right drug. 3. The right time. 4. The right dose. 5. The right route of administration. 6. The right focus on individual performance and overlook crucial system components that contribute to errors. Errors, however, can still occur even after these 5 rights have been verified. What are some system-based causes of medication errors? Some causes of medication errors are the lack of information about the patient, which includes parameters such as age, weight, allergies, diagnoses, pregnancy status, lab values, vitals signs. Also, some system-based causes of medication errors are the lack of information about the drug, such as text or computerized references, and communication and teamwork failures. Other system-based causes are unclear, unlabeled, or look-alike drug labels and packages. Moreover, unsafe drug standardization, storage, and distribution, and non-standard, flawed or unsafe medication delivery devices can also cause medication errors. Other causes can include inadequate staff orientation, ongoing education, supervision, and competency validation. Also, inadequate patient education about medication and medication errors. Further, there is a lack of a supportive culture of safety, and also the failure to learn from mistakes. Interpretation of prescriptions and medication orders. 1A prescription is an order for medication issued by a physician, dentist, or other licensed medical practitioner. 2 prescriptions designate a specific medication and dosage to be prepared by a pharmacist and administered to patient. 3 may be presented at the pharmacy by the patient or sent directly to the pharmacy by telephone, fax, or other electronic means, e.g. e-prescriptions. Pharmacist reduces to written form or computer entry. 4 in hospitals and other institutions, a medication order is used. 5 for children include age, weight, and or body surface area. This may be required to calculate the appropriate dose. Prescriptions and medications orders. For handwritten prescriptions, tamper-resistant prescription pads have been developed. Prevent the unauthorized copying, modification, or counterfeiting of prescriptions. Tamper resistance is achieved through the use of 1. Security paper, 2. Erase-resistant paper, 3. Thermochromatic ink, 4. Embedded holograms. Probable causes of non-compliance. Unclear or misunderstood directions. Undesired side effects that discourage use. Lack of confidence in the drug or the prescriber. Discontinued use due to feeling better or worse. Economic reasons based on the cost of the drug. Absence of patient counseling. Confusion over taking multiple medications. Patient forgot to take medication. Percent compliance rate. Percent compliance rate, number of days supply of drug, over the number of days since Rx refill, multiplied by 100. There are levels of organization. From atom to molecule or compound to organelle to cell to tissue to organ system. Chemical level refers to the atoms, molecules, and macromolecules which form nucleic acids, proteins, carbohydrates, and lipids. Cellular level refers to the atoms, molecules, macromolecules, which form the functional and structural unit of life, and basic and specialized functions. For the tissue level of organization. Tissue level cells of similar shape and specialized function. There are 4 major tissue types. 1. Muscle specialized for contracting and generating tension. 2. Nervous specialized in impulse production and transmission. 3. Connective specialized in connecting and supporting. 4. Epithelial specialized in surface lining and exchange. Organs level and organ system level. The organ level is composed of 2 or more tissues that perform a common function. The organ system level is composed of 2 or more organs that work to perform a common function that is essential to survival, and these include, the digestive, respiratory, cardiovascular, and the human body contains 11 systems. The organism, this is a collection of body systems working together to maintain life. The parts of an organism strive to maintain an internal balance, and this includes homeostasis. Levels of structural organization. 1. Circulatory system, heart, blood, and blood vessels. Digestive system, mouth, pharynx, esophagus, stomach, small intestine, large intestine, salivary glands, exocrine pancreas, liver, and gallbladder. Respiratory system, nose, pharynx, larynx, trachea, bronchi, and lungs. Urinary system, kidneys, ureters, urinary bladder, and urethra. Skeletal system, bones, cartilage and joints. Muscular system, skeletal muscles. Integumentary system, skin, hair, nails. Immune system, lymph nodes, thymus, bone marrow, tonsils, and adenoids. Nervous system: brain, spinal cord, peripheral nerves, and special sense organs. Homeostasis. The maintenance of a stable internal environment. 37 degrees Celsius, pH 7.3 to 7.4. The internal environment is made of the extracellular fluid or ECF. Homeostatic control systems. Network of body components that operate to maintain a given factor in the internal environment relatively constant around an optimum level. These include local intrinsic controls which are inherent, or built into a particular organ. There are also systemic, extrinsic, controls outside of an organ, involves neural and endocrine regulation, and coordinate various organs and systems. Negative feedback loops. Negative feedback loops operate by maintaining homeostasis by detecting a deviation from a set point and acting to restore that set point. 4 components of a negative feedback loop. 1 controlled variable. 2 sensor. 3 control center. 4 effector. All the feedback mechanisms that maintain homeostasis use negative feedback. Stimulus to sensor to control to the effector. Other regulatory mechanisms. There are also positive feedback loops. 1 in positive feedback loops, they continue increasing a change. 2 in positive feedback loops, the controlled variable moves in one direction. An example of positive feedback loops is uterine contractions. Steps. 1 nerve impulses from the cervix are transmitted to the brain. 2 the brain stimulates the pituitary gland to secrete oxytocin. 3 the oxytocin is carried in the bloodstream to the uterus. 4 the oxytocin stimulates uterine contractions and pushes the baby toward the cervix. 5 the head of the baby pushes against the cervix. There is also feed-forward mechanisms. Feed-forward mechanisms anticipate change and respond to that change before it happens and maintains stability. Examples of this are watering of mouth, salivation, as a result of sight, smell, or thought of food. Also, there is a rise in respiration before exercise, as well as the increased secretion of insulin as a result of food in the digestive tract, and this avoids excessive rise of glucose in blood after the meal. There is also homeostasis. Homeostasis is a condition of equilibrium, balance, in the body's internal environment. Homeostasis helps the body maintain an almost constant internal environment. This is tied to a dynamic condition, and there is a narrow range which is compatible with maintaining life. For example, blood glucose levels range between 70 to 110 mg of glucose/dl of blood. Moreover, the whole body contributes to maintaining the internal environment within normal limits. Additionally, there is homeostatic balance. However, homeostasis can be disrupted, due to physical insults such as intense heat or lack of oxygen. Additionally, changes in the internal environment such as the drop in blood glucose due to the lack of food. Also, there is physiological stress such as the demands of work or school. Furthermore, there are disruptions which can be mild and temporary in which balance is quickly restored. However, they can be intense and prolonged which involve poisoning or severe infections. Homeostatic and body fluids. Homeostasis also involves maintaining the volume and composition of body fluids which are important. Body fluids are defined as dilute, watery solutions containing dissolved chemicals inside or outside of the cell. There is also intracellular fluid, which is the fluid within cells. Furthermore, there is extracellular fluid, which is the fluid outside cells, and this also includes the interstitial fluid, which includes the extracellular fluid between cells and tissues. We can also view the body as an open system, which exchanges materials and energy with its surroundings. Further, in terms of the percentage of water for a newborn infant, it is made of 80% water, an adult male is made of 60% water, and an adult female is made of 50% water. Elderly people can be made of about 45% water. Also, it is worth noting that the extracellular fluid includes the plasma, the interstitial fluid and the transcellular fluid, which is located in specific anatomical areas. The transcellular fluid includes the CSF, the intraocular fluid, the pleural fluid, the peritoneal fluid, the synovial fluid and the digestive secretions. It is also worth noting that solutes involve dissolved particles. Electrolytes are charged particles inclusive of cations, which are positively charged ions such as sodium cations and potassium cations. Anions, which are negatively charged ions such as chloride ions, and bicarbonate ions. Additionally, non-electrolytes are uncharged such as proteins, urea, glucose, oxygen, and carbon dioxide. In terms of sodium concentration and potassium concentration, sodium is around the same in the plasma and interstitial fluid, however it is around 10 in skeletal muscle. However, for potassium, the ion concentrations in the plasma and interstitial fluid is rather small, however the concentration inside the skeletal muscle is large. Intra-ECF water redistribution. Plasma versus interstitium. This includes the balance of Starling forces acting across the capillary membrane. 1. Osmotic force. 2. Hydrostatic force. The balance between hydrostatic and colloid osmotic forces across the capillary membranes. There is also the intracellular versus the extracellular, which involves looking at the osmotic effect, e.g. electrolytes. It is important to note that plasma osmolarity measure ECF osmolarity. This is good since plasma is clinically accessible, and dominated by sodium ion concentration and the associated anions. Also, under normal conditions, ECF osmolarity can be roughly estimated as P_osm equals 2 times the concentration of sodium in the plasma, which is 270 to 290 milliosmolar. The ECF vs ICF. The extracellular fluid contains large amounts of sodium, chloride, and bicarbonate ion. Nutrients for the cells, such as oxygen, glucose, fatty acids, and amino acids. It also contains carbon dioxide that is being transported from the cells to the lungs to be excreted. Additionally, other cellular waste products are being transported to the kidneys for excretion. Furthermore, the intracellular fluid contains 1. Large amounts of potassium, 2. Magnesium, 3. Phosphate ions instead of the sodium and chloride ions found in the extracellular fluid. The intracellular fluid contains special mechanisms for transporting ions through the cell membranes, which maintain the ion concentration differences between the extracellular and intracellular fluids. Homeostasis involves several types of regulation. There is thermoregulation, osmoregulation, and glucoregulation. The organs of homeostasis are the brain, muscles, skin, lungs, pancreas, and kidneys. Why control temperature? Environmental temperature is constantly changing. However, the body must be kept at a constant temperature of 37 degrees Celsius. This is the optimum temperature for the body's enzymes. Even the slight changes in body temperature can have a life-threatening effects on health. If body temperature falls too low, reactions become too slow for cells to survive too high, and the body's enzymes are at risk of denaturing. Some important properties of carrier proteins are that they are stereoselective, there can be channel saturation which in diabetes is uncontrolled, and there can be competition. Channel saturation, in simple diffusion, increases proportionally with concentration of substance. Classes of antineoplastic agents include G2 inhibitors, M inhibitors, G1 inhibitors, and S inhibitors. G2 involves double-checking the DNA. M or mitosis involves cell splitting. G1 involves the cell contents being duplicated and S involves the DNA synthesis. G2 inhibitors are etoposide, tenofovir, irinotecan, topotecan. S inhibitors are azathioprine, cladribine, cytarabine, 5-fluorouracil, 6-mercaptopurine, hydroxyurea, and methotrexate. Also, M inhibitors include vincristine, vinblastine, paclitaxel, and eribulin. Also, G1 inhibitors include cisplatin, busulfan, cyclophosphamide, and nitrosoureas. Antineoplastics agents. The international non-proprietary name or official generic name will be followed by the route of administration, which will be followed by the mechanism of action. After which we will read the indications and the major toxicities. The first group of antineoplastic agents includes 1. Cytotoxic antineoplastics. The first subgroup of this group is 1. Nucleoside analogues. 1. Azacitidine. The route of administration can be subcutaneous or intravenous. The mechanism of action involves azacitidine acting as a DNA methyltransferase inhibitor, and azacitidine incorporates itself into RNA, hence inhibiting gene expression. The indications for azacitidine include myelodysplastic syndromes, acute myeloid leukemia and chronic myeloid leukemia. Additionally, the major toxicities include myelosuppression, kidney failure, uncommon/rare, renal tubular acidosis and hypokaliemia. Reference: NIH website www.ncbi.nlm.nih.gov/books/NBK548022. Antineoplastic agents. Alkylating agents: O-altritamine, bendamustine, busulfan, carmustine, chlorambucil, cyclophosphamide, dacarbazine, ifosfamide, lomustine, lurbinectidine, mechlorethamine, melphalan, procarbazine, streptozicin, temozolomide, thiotepa, trabectedin. O-platinum coordination complexes: carboplatin, cisplatin, oxaliplatin. Antibiotics: cytotoxic. O-bleomycin, dactinomycin, daunorubicin, doxorubicin, epirubicin, idarubicin, mitomycin, mitoxantrone, plicamycin, valrubicin. Antimetabolites: O-antifolates, methotrexate, pemetrexed, pralatrexate, trimetrexate. O-purine analogues: azathioprine, cladribine, fludarabine, mercaptopurine, thioguanine. O-pyrimidine analogues: azacitidine, capecitabine, cytarabine, decitabine, floxuridine, fluorouracil, gemcitabine, trifluoridine/tipiracil. Biologic response modifiers: O-aldesleukin, IL-2, denileukin diftitox, interferon gamma. Histone deacetylase inhibitors: O-belinostat, panobinostat, romidepsin, vorinostat. Hormonal agents: O-antiandrogens, abiraterone, apalutamide, bicalutamide, cyproterone, enzalutamide, flutamide, nilutamide. O-antiestrogens, including aromatase inhibitors anastrozole, exemestane, fulvestrant, letrozole, raloxifene, tamoxifen, toremifene. O-gonadotropin-releasing hormone analogues: digorilix, gosrelin, hystrelin, luprolide, rilugolix, triptorelin. O-peptide hormones: lanreotide, octreotide, pasireotide. Monoclonal antibodies: O-alemtuzumab, atezolizumab, avelumab, bevacizumab, blinatumomab, brentuximab, semiplimab, cetuximab, daratumumab, dinutuximab, dostarlimab, durvalumab, elotuzumab, gemtuzumab, enotuzumab, ozogamicin, ipilimumab, megamulizumab, moxetumomab, pseudotox, nicitumumab, nivolumab, ofatumumab, olaratumab, panitumumab, pembrolizumab, pertuzumab, ramucirumab, rituximab, teclistamab, tositumumab, trastuzumab, tremelimumab. Protein kinase inhibitors: O-abemaciclib, acalabrutinib, afatinib, alectinib, alpelisib, axitinib, binimetinib, bortezomib, bosutinib, brigatinib, cabozantinib, carfilzomib, siratinib, cobimetinib, copanlisib, crizotinib, dabrafenib, dacomitinib, dasatinib, duvlazib, inazatinib, encorafenib, ontrectinib, erdafitinib, erlotinib, fedratinib, futibatinib, gafatinib, gilteritinib, glasdegib, ibrutinib, idlaisib, imatinib, infigratinib, ivosidenib, ixazimib, lopatinib, larotrectinib, lenvatinib, lorlatinib, midostaurin. Naratinib, nilotinib, niraparib, olaparib, osimertinib, palbociclib, pazopanib, pemigatinib, pexidartinib, ponatinib, regorafenib, ribociclib, rucaparib, ruxultinib, selumetinib, sinidegib, sorafenib, sunitinib, talazoparib, trametinib, vanditanib, vemurafenib, vismidegib, zonubrutinib. Taxanes. Ocabazitaxel, docetaxel, paclitaxel. Topoisomerase inhibitors. Oediposide, irinotecan, tenopozid, topotecan. Vinca alkaloids. Ovinblastine, vincristine, vinorelbine. Moving right along with the next section. Action potential. Resting membrane potential. It is the voltage difference existing across the cell at rest. This exists in all cells. RMP, -70 to 90 MV. RMP is contributed by Na/K-ADPase, 0. Membrane potential. The potential difference between inside and outside the membrane. Due to different concentrations of ions, such as sodium, Na+, high outside, and potassium in large protein molecules inside. Na and ions create positivity outside and inside the cell. 1. Resting membrane potential, voltage difference across the cell membrane at rest, typically -70 to -90 MV. 2. Why is the resting membrane potential -70 MV? 1. Na+/K and ADPase channel pumps 3 Na and out and 2 K and in, making the internal charge more negative to -5 MV. 2. K and will leave the cell through leaky K channels, making the charge to -90 MV. 3. Leaky Na and channels will pump Na and back into the cell, making the charge -70 MV. 4. K and goes back inside to go back to -90 MV. 3. Nernst potential, equilibrium between the K and voltage inside and outside the cell. 4. Depolarization, excitatory post-synaptic potential. Glutamate binds to ligand-gated channel to bring in large amount of Na and Ca and bringing the charge to -55 MV. 5. Hyperpolarization, inhibitory post-sympathetic potential. GABA binds to ligand-gated channel to bring in Cl, bringing the charge to -90 MV. 6. Temporal summation, 1 neuron, multiple signals. 7. Spatial summation, multiple neurons firing different signals. 8. Action potential, 1. Na and voltage-gated channels open at -55 MV and close at 30 MV. 2. When 30 MV is reached, the K and voltage-gated channels will open and K and will leave, bringing the charge to -90 MV. K and is attached to proteins and anions. Simultaneously, Ca and tells the vesicles to release acetylcholine via exocytosis. 9. Absolute refractory period, depolarization and repolarization. 10. Relative refractory period, hyperpolarization. Routes of administration guide. IT intrathecal in the spine. 4. Intravenous. IM intramuscularly. PO by mouth. Topical, referring to applying to a specific place on the body such as skin or mucous membranes. Note, purpose of these episodes not at all for advice or medical suggestions. These are aimed to provide support for peer pharmacists in training in educational and intellectual stimulating ways. Again, these are not at all for medical advice or for medical suggestions. Please see your local state and board certified physician, PA or NP, and pharmacist for medical advice and suggestions. The views in this podcast represent those of my guest, S, and I.
Welcome to the New Chemist podcast, one of the best chemistry podcasts globally. We are glad you are listening. We encourage you to subscribe and continue to listen.
Welcome to the New Chemist podcast. We are glad you are listening. We are one of the best chemistry podcasts globally. We encourage you to subscribe and continue to listen.
Listen to the New Chemist podcast.
We are so glad you are listening. Feel free to subscribe on Spotify and tell your friends and colleagues about the podcast.
Our Deepest Fear by Marianne Williamson. Our deepest fear is not that we are inadequate. Our deepest fear is that we are powerful beyond measure. It is our light, not our darkness, that most frightens us. We ask ourselves, who am I to be brilliant, gorgeous, talented, fabulous? Actually, who are you not to be? You are a child of God. Your playing small does not serve the world. There's nothing enlightening about shrinking so that other people won't feel insecure around you. We are all meant to shine as children do. We were born to make manifest the glory of God that is within us. It's not just in some of us, it's in everyone. And as we let our own light shine, we unconsciously give other people permission to do the same. As we're liberated from our own fear, our presence automatically liberates others. Our Deepest Fear by Marianne Williamson. You are very important, especially to us here at the New Chemist podcasting group. You listening in is significant.
Vous êtes très important, surtout pour nous ici au New Chemist Podcasting Group. Votre écoute est significative.
Usted es muy importante, especialmente para nosotros aquí en The New Chemist Podcasting Group. Usted escuchando, es significativo.
Você é muito importante. Especialmente para nós do The New Chemist Podcasting Group. Você ouvindo, é significativo.
Είστε πολύ σημαντικοί, ειδικά για εμάς εδώ στο The New Chemist Podcasting Group. Το να ακούς είναι σημαντικό.
Sie sind sehr wichtig, besonders für uns hier bei The New Chemist Podcasting Group. Es ist wichtig, dass du zuhörst.
Je bent erg belangrijk, vooral voor ons hier bij The New Chemist Podcasting Group. Dat je meeluistert, is veelbetekenend.
You are very important, especially to us here at the New Chemist Podcasting Group. You listening in is significant. Welcome to the New Chemist Podcast.
Bienvenidos al podcast del nuevo químico.
Καλώς ήρθατε στο podcast του New Chemist. Welkom bij de podcast van The New Chemist.
Bienvenue sur le podcast du nouveau chimiste.
Bem-vindo ao podcast do novo químico.
Welcome to the New Chemist podcast. Work hard. Be value-driven. You can do it. You can grow and learn it. You can be the difference you and your community needs. Don't give up. We are here, rooting and cheering for you. Don't give up.
Travaillez dur. Soyez axé sur la valeur. Tu peux le faire. Vous pouvez grandir et l'apprendre. Vous pouvez être la différence dont vous et votre communauté avez besoin. N'abandonnez pas. Nous sommes ici pour vous encourager et vous encourager. N'abandonnez pas.
Trabalhar duro. Seja orientado por valores. Você consegue. Você pode crescer e aprender. Você pode ser a diferença que você e sua comunidade precisam. Não desista. Estamos aqui torcendo e torcendo por você. Não desista.
Δούλεψε σκληρά. Να οδηγείτε στην αξία. Μπορείς να το κάνεις. Μπορείτε να μεγαλώσετε και να το μάθετε. Μπορείτε να είστε η διαφορά που χρειάζεστε εσείς και η κοινότητά σας. Μην τα παρατάς. Είμαστε εδώ για να σας ζητοκραυγάσουμε. Μην τα παρατάς.
Trabaja duro. Sea impulsado por el valor. Puedes hacerlo. Puedes crecer y aprenderlo. Usted puede ser la diferencia que usted y su comunidad necesitan. No te rindas, estamos aquí animándote y animándote. No te rindas.
Werk hard. Wees waardegedreven. Je kunt het. Je kunt groeien en leren. U kunt het verschil zijn dat u en uw gemeenschap nodig hebben. Geef niet op. We zijn hier om voor je te roten en te juichen. Geef niet op.
Work hard. Be value-driven. You can do it. You can grow and learn it. You can be the difference you and your community needs. Don't give up. We are here rooting and cheering for you. Don't give up. Thanks for listening. We're glad you were able to tune into this podcast. Once again, this is the New Chemist, where we discuss chemistry, which simply put is the science of change, as well as the other sciences, careers, community, research, and COVID-19. Thanks again for listening. Note, the views on this podcast represent those of my guests and I.
In the world of pharmacy, we lay the claim. Knowledge and compassion is the golden flame. Science and practice, side by side they groove. In a student's journey, we find the move.
This is the New Chemist podcast breaking news announcement. Good evening, ladies and gentlemen. We interrupt your distractions to remind you of the ambitions that fuel your aspirations. We interrupt your diversions to furnish you with pivotal notions and ideas to realize your objectives. We interrupt your preoccupations to underscore the importance of maintaining good health, extending a hand to others in their pursuit of well-being. And now, we are delighted to begin this episode of the New Chemist podcast, a beacon of knowledge and insight for educational purposes. Stay tuned for a word of discovery. This is the New Chemist podcast, and we are here to keep you informed and inspired.